Hi, I'm Emily. I'm going to be your NP today, performing your HENT exam. Um, I'm going to start with your head, look at your face, your hair, your scalp. Everything's symmetrical with no scarring. I'm going to palpate your temporal pulses. Good. I'm going to start testing some of your cranial nerves. So can you raise your eyebrows, frown, puff out your cheeks, smile with teeth, and close your eyes tight. Good. Now I'm going to have you close your eyes and tell me when you feel me touching you.
Yep. Yep. Yep.
Sorry.
Yep.
Okay. Now you can open your eyes. I'm going to palpate your masseter and temporal muscles by palpating your temporal mandibular joint. So can you clench your jaw? Good. And can you open and close your mouth a few times? Good. Good. Now I'm going to move on to your eyes. Your eyelashes and your eyebrows are symmetrical. I'm going to look at your conjunctiva. So you're going to look up, look down, look left, and look right. Good. Now I'm going to have you follow my finger without moving your head. Good. That was testing for convergence, accommodation, and the EOMs. Now I'm going to test your pupillary response. So I'm going to dim the lights, and I'm going to have this light flash in your eye, and try not to blink, but just look straight ahead, like right past me. I'm testing for, look straight. I'm testing for pupillary response, like direct and consensual. Good. Now your right eye, look at me. Good. Direct and consensual. So now I'm going to look at the back structures of your eye. Same thing, try not to blink and just look straight ahead. So your left eye, my left hand, and my left eye. I am looking, I see the red eye reflex. I see the blood vessels. As I look medially, I see the disc in the cup, and as I look laterally, I see the fovea and the macula. Okay, and now the other side, same thing, just look straight ahead with your right eye, my right hand, and my right eye. There's the red eye reflex. I see the blood vessels, and I'm moving medially with the disc and cup, and then looking laterally to the fovea and the macula. Great. So that's your eyes. After your eyes, I'm gonna move on to your ears. I'm gonna palpate your ears. They feel symmetrical. Doesn't hurt at all, right? Good. So now I'm gonna perform the whisper test. You're gonna repeat after me. Okay.
Dog. Cat. Mouse.
Good. Oh, sorry.
Red. White. Blue.
Good. Now I'm going to perform the exam where I, my otoscopic exam. And I'm going to assess the inside structures of your ear. So I'm going to pull the pinna up and back. The TM is pearly gray. No ceruum, and the external auditory canal looks great. So same thing on this side. And I'm gonna go in. Okay. TM's pearly gray. External auditory canal looks good. Okay. This. Don't worry about that after. Now we're gonna move on to your nose. So your nose is symmetrical, no scars or deviations. I'm gonna perform the sniff test, so I'm gonna check for patency. So good. And now I'm going to assess inside, and you can leave your head normal. And I'm going to be looking at the mucosa and the turbinates. Okay, on the other side. Okay, no polyps or obstructions. Now I'm going to go to your mouth. I have to switch this. I'm going to be looking at the inside of your mouth. So if you could open up for me, you can put your tongue in your mouth. Open. Looking at your gums, your lips, your teeth, the soft and hard palate, your posterior pharynx. Good. Stick out your tongue. Yep. And your uvula is midline. Say ah. Okay. Now I'm going to perform the gag test. Good. There we go. Now I'm going to move on to your neck. There are no visible masses or deviations or scars. Your trachea is midline, neck symmetrical. I'm going to palpate your lymph nodes. So your pre-auricular and your post-auricular, your occipital. And I move down here to your submandibular and your submental. Then I come back, I'm gonna palpate your posterior cervical chain and your anterior cervical chain, and then your supraclavicular lymph nodes. Good, and then I'm gonna have you shrug your shoulders against my hands. Good, and then the last part is your thyroid. So I'm gonna have you remove, so that, yeah, just, you could just stand and turn, yeah, that works. So you're gonna take your glass and you're gonna take a sip and hold it in your mouth. I'm gonna feel your Adam's apple down from there and out a little to palpate the thyroid. And okay, so you're gonna put your head down and to the right, tilt the whole head, there you go. And pushing to the right, swallow. Okay, bring your head back up, and now you're gonna take another sip and we're gonna do the other side. Okay, put your head down to the left, roll it, there you go. And pushing and swallow. Okay, good job. That completes our HENT exam.